All right, students, last chapter. We're on chapter 12. So let's open it up. And there we are. Respiratory system, digestive system, urinary system, and reproductive system. So massage influence, as far as adapting to support normal, mimic normal, there are a couple of distinct areas that we can do that with. In the respiratory system, it's dysregulated breathing or breathing pattern disorder. And in the digestive system, we can intervene to support colon motility. So constipation, for example. When we're thinking about the reproductive system, it is a knowledge structure so that we can adapt massage to work with clients through a pregnancy, pre and post pregnancy, pre and post natal, as well as some awareness of generalized pathology in the area. The urinary system, we don't have the ability to have as much as a direct effect on the urinary system, but we have an indirect effect, just like we do on all of these body systems, through the neuroendocrine response. So here we go. Here's the chapter objectives for all four of these systems. Here's your key terms. Again, these are the ones you're going to want to be able to recognize and define. Learning how to learn, and then here we are in our respiratory system. So you're going to want to read through here and study what respiration is in general and what external respiration and internal respiration is. And then you're going to want to realize the distinction between the upper respiratory tract and the lower respiratory tract. We got a big truck going by. I don't know if you can hear that or not. Here's your diagram. You're going to know where these structures are at and what they do. So you've got your nose, you got your sinuses, the pharynx, the larynx, trachea, lungs, diaphragm, which is muscle, but it's the main muscle that changes shape and moves up and down during contraction and relaxation that creates the pressure change inside the chest cavity. The thorax is the trunk. So in particular, it is the upper region of the torso. And that's where we focus massage if we're going to support, try to get a more direct support for breathing function, is the thorax area. So we know everything works with everything. So we have nerves and vessels, circulation and lymphatic exchange. And then you want to slow down here and understand the mechanism of breathing, how we inhale and exhale. In your support videos, I am going to sneeze, which is a really aggressive form of an exhale. So there you go. I wanted to demonstrate that for you. And so the support videos, the support YouTube videos related to breathing on the monthly study schedule that I post for you gives you more and more repetition on this content. So these are, so what we interface with is the musculoskeletal system, and then indirectly we interface with the neuroendocrine response. These are the muscles. This is what we want to be thinking about if we're going to support breathing function. And then this is the sequence of inspiration, bringing the air in. And then this is expiration, taking the air out. And the rate of that, the interaction between the rate of this is going to determine the oxygen and other chemical content of the blood, which is then going to, through chemoreceptors, is going to feed into the nervous system and then secondarily into the endocrine system. And it's going to be a determinant of where we are in that parasympathetic, sympathetic kind of balance. And that's why controlled breathing is a big part of meditative processes. So in general, our inspiration should be shorter than our expiration. We should inhale, for example, to a count of 1 or 2, and then exhale for double that time. So your exhale is longer than your inhale. If that gets reversed, then it ends up being what we call breathing in excess of demand. That can lead to breathing pattern syndrome, disordered breathing, and that is going to directly be involved in dysregulation of the autonomic nervous system. Lung volumes, this is general knowledge here. Transport of oxygen, carbon dioxide. Then how do we control the breathing? Now, that happens in the brain stem. And then we just talked a little bit about breathing rate, and here's that breathing pattern disorder and hyperventilation. So when we get into the pathology, we've already talked a little bit about infections, but we'll focus on upper and lower respiratory infection here. And the sinuses, which are air pockets that warm the air, but they're kind of closed containers a little bit with small holes that drain. And so it can, can become mucus clogged and then susceptible to bacterial infection. A sore throat, and a lot of this is contagious in through here, and we spread it just like I did with my magnificent sneeze a few minutes ago. We can spread the droplets, the respiratory droplets, and then they land on surfaces and people can touch it, and then they touch their eye or their nose, or and so that's how things are spread. And again, we lived through a pandemic, and so our society is very aware of these mechanisms of transference of respiratory conditions. Pneumonia can be bacterial, viral, and chemical. Asthma now is a dysfunction of the vasoconstriction and vasorelaxation of the airway. It's sometimes triggered by an allergy. It is an inflammatory issue. The chronic obstructive pulmonary disease, COPD, this usually is related to damage of the lung. You can have chronic bronchitis as well, and that is usually ongoing damage related to irritation, such as cigarette smoke. Pleurisy is an infection of the membrane around the lung. Lung cancer is one of the more common cancers. And so it is likely that you will work with somebody that has had lung cancer, treated for lung cancer. Pulmonary edema, pulmonary is lung, and edema is accumulation of fluid. And this can happen for a lot of reasons. It can be where the heart is not pumping well enough. It can be kidney disease. It can be a pneumonia. It's more of a symptom of something than it is a disease proper. Tuberculosis now is common, and this is contagious, and we wish it wasn't common, but we do need to follow standard precautions to protect ourselves and others from tuberculosis. Cystic fibrosis is not contagious. It is a mucus disorder. Everybody should know with first aid how to treat somebody or provide first aid for somebody who is choking. In recent years, there's been much more focus on sleep apnea or interrupted breathing during sleep. And a lot of people now use devices to keep their airway open while they sleep. And then infant apnea is also part of this still trying to understand sudden infant death syndrome. Carbon monoxide poisoning occurs because carbon monoxide will move into the oxygen receptors. And so it's an environmental thing that occurs. Emphysema is the end result of long-term irritation of the bronchi. And it's an accumulation of mucus. It's where the small little air sacs are non-functional. The tissues become less elastic. People usually with emphysema, they'll usually be using a oxygen pump with a cannula here. And then here's breathing pattern disorder. And this is where I want you to slow down and pay attention, because this is a syndrome and it has lots of symptoms that go with it that are related to a normal function happening at an abnormal time. And we can learn to breathe abnormally. That, you know, if we have had a bad upper respiratory infection or a lower respiratory infection, we've seen this in COVID. Afterwards, there's this dysregulated breathing that comes on and lingers, and it has ongoing symptoms that go with it. This can occur with anxiety, or it's a normal part of the fight or flight response. But when we are fighting or flighting, running for our lives, increased oxygen and these physiological changes are part of survival. But when we're sitting still, and it doesn't make any sense, and so our heart rate increases, and we start to get even more anxious, and a full-blown panic attack is a really awful experience. And one of the ways of re-educating towards homeostasis is to take a look at this breathing pattern, this disordered breathing, and various relearning activities that go with it. So where the massage therapist kicks in sometimes is the recognition that this may be disordered breathing. And then our intervention is to work to see how efficient we can get the inspiration and expiration working in the thorax. So these are all the different symptoms that people can have. And then if they go to their physician and take a look, they just really don't find anything. Oftentimes it's very situational. And some of the reasons why body-mind interventions work so well is because they have mechanisms that are using controlled breathing, that inhale, exhale, breathing ratio. So you might want to even do a little self-assessment here, and especially if you have a tendency towards anxiety, or you think you might have some dysregulated breathing. I myself just assume that people have a version of this, and so I spend time with the torso. And in the fundamentals book, there's a very focused section on interacting with breathing disorder and assessment with it. But you'll see it, the shoulders will come up and down. People will be breathing with their upper chest. They'll have inhale, there'll be some signs of trying to regulate that inhale, exhale ratio. They'll sniff, they'll cough. Those can also show up. So slow down, and when you're doing, practice doing your own history here and saying, okay, do I have times of shortness of breath when I don't feel like I can get a real diaphragmatic breath? Do I have a irritable cough? Do I feel like I have to clear my throat a lot? Do I notice my heartbeat? Does it beat fast and then maybe beat a little slow? Do I have vasomotor symptoms like hives or Raynaud's phenomenon? Do I get dizzy, feel unsteady? Do I have visual disturbances? Do I have a sensation of pins and needles? I've already talked about anxiety here, tearfulness, feeling kind of unreal or kind of out of one's body. Uh, you can even have little hallucinations because your vision is distorted, because you're looking more, that you get a peripheral vision increase. And so you see something out of the corner of your eye that you might not notice. Concentration and memory are problematic. The sleep becomes disturbed because you're vigilant all of the time. Gastrointestinal, you'll get a dry mouth, the GERD, acid regurgitation. Because you're swallowing air a lot, you might be gassy, bloating. Digestion is just not very good because if you are breathing in excess of demand, you're in a sympathetic pattern and you just don't digest very good there. And then with your muscular system, you're getting ready, and so especially in the attack muscles, that tone will increase because you need to be ready to fight or flight, or you'll freeze up. That's another part of it. And so you'll see changes in tone and connective tissue density increase if that sympathetic autonomic nervous system is inappropriately stimulated. And eventually you're going to exhaust. So yeah, this is way too common. And so it behooves you to slow down and pay attention to this. And it can be managed with lifestyle changes and breathing retraining. So here's your indications and contraindications for the respiratory system and your little summary. This is, read through these. If there's something that you can't recall when you're reading through it, then you need to stop and go back and take a look. So the digestive system is another area that we can have a direct and indirect influence on. We can actually massage the abdomen, we can encourage peristalsis, and we can have a more focal intervention to work with supporting the large intestine function. Indirectly, we are primarily working through the autonomic nervous system and the neuroendocrine response. And we talked earlier about the gut microbiome and the importance of that and the interaction with that in the endocrine system. So digestion is a characteristic of life, way back in chapter 2. And it's the physiological process of intaking and breaking down nutrients for the use of the body and then eliminating the waste. And it's a great big tube. Starts at your mouth and ends at the other end. So this goes through the hormonal and functional aspect of digestion and works, what does the hypothalamus do with that? And interestingly, we have got more use of some medications for weight control, and secondarily, and also diabetes that work on ghrelin and leptin. And so that's also part of this whole digestion chemical soup that goes on, and the chemical interface with that. Want to pay attention to the microbiome and the influence of the gut. They are again seeing that this interface is much more body-wide than just located in the digestive system. So we've got the gut-brain axis, and it's a symbiotic. These are little colonies of creatures living in us that help us if we let them. We also have this similar little colonies that don't help us. And we want to feed, we want to support and nurture this beneficial, these beneficial gut microbes, because they talk to our brain. That's part of the enteric division of the autonomic nervous system. The vagus nerve is involved with this. So very interesting, evolving research area. Here are your parts. You're going to want to kind of know the names of the parts here. If so these terms, these figures, kind of narrow that down on what you need to know. We've got these various structures in the abdominal cavity. Adipose tissue is part of the mesentery and the omentum, and it is considered an endocrine organ. So you're going to want to pay attention to the different types of adipose tissue and where it tends to accumulate. Then we've got our mouth and our pharynx and our esophagus and our stomach, and then the small intestine and the parts of the small intestine. This is language you need to know. And the job of the small intestine is to absorb nutrient and get it into the bloodstream so that it can circulate. And then the large intestine is to absorb water and concentrate the waste material. A little practical application on abdominal massage and the importance of it. Then we've got additional organs. We've got the pancreas, and the inlets of Langerhans are there. That's part of the diabetes. You know, they produce insulin and glucagon, and so this overlaps, the endocrine system overlaps into the digestive system. The liver, I love the liver. It's a very amazing organ. And given half a chance, it will actually regenerate itself. Gallbladder, then your large intestine, and then this is where we would concentrate a more focal massage application if we're trying to help somebody with constipation. Lots of bacteria, lots of stuff that, you know, we have colonies of creatures. It's kind of interesting. The nervous system that's involved with this, I already talked about vagus nerve. And peristalsis, this is a smooth muscle structure, this tube. And peristalsis is very rhythmic like this. And so when we generally massage the abdomen, we're kind of encouraging or reinforcing peristalsis. Digestion is very chemical. You won't have to memorize all of these. So this is more in the nice to know category. And then this is a good summary. If you can sort out this figure, that gives you a pretty good summary of how the whole digestive process from the mouth all the way down to the elimination occurs. So here it is with these terms: ingestion, digestion, absorption, and then elimination or egestion. Here are some of your digestive chemicals. It's an acidic involvement, and because it breaks things down. Now you're not going to be tested on the Krebs cycle, but it is part of understanding a general digestive process. So just be aware that it's there. And then we also have to have a working knowledge of generally recommended nutritional information. So here's our main food groups, vitamins and what they do, minerals, and function of various minerals in the digestive process and the nutritional health. The metabolic rate is how fast we burn energy. And if our metabolic rate is in excess of the calories we bring in, then we'll start to lose weight. If it's the reverse, then we'll start to accumulate fat stores. So, and then stimulants increase the metabolic rate. And so it used to be that people would take stimulant drugs as part of a weight loss plan, we realize how dangerous that is for the body. So you can stimulate metabolic rate through aerobic exercise. So sitting in a sauna where your body has to deal with an increase in temperature or shivering in the cold will influence metabolic rate. And then here are your pathological conditions. Watch for eating disorders. They can become quite serious and life-threatening, and they are stress-related and require multidisciplinary interface to help the person find a better way of coping. Constipation, hemorrhoids, gastrointestinal stuff. Lots of times we'll say we've got the flu, but it's really a kind of a inflammation or some sort of infection in the gut. And different diarrheas. And the big issue here is that you can become dehydrated. Inflammatory bowel disease is an autoimmune condition. Reflux, GERD, will sometimes mimic heart conditions. So you have to rule that out and make sure that somebody isn't interpreting the pain that they think it's GERD, but it really is a symptom of coronary artery disease. Peptic ulcer is almost always actually a bacterial infection that they can treat. Appendicitis is a medical emergency. A hernia is a space in the abdomen where the abdominal wall is not, it's got weakening in it, and parts of the abdominal contents can protrude through. You can see it sometimes at the umbilicus, at the belly button, or down by the groin. Those can become entrapped. Those structures that are pushing through the abdomen can become strangulated, and then that is a medical emergency. If you are encountering a herniated area, just don't push hard into the area. Nutrient disruption, diverticulitis disease, cirrhosis is the connective tissue infiltration and the fat infiltration of the liver and interferes with its function. And then you can have obstructions, bowel obstructions, people who take opiate based drugs can slow down their intestinal tract so much that they will get obstruction. You can have true adhesion, not a stickiness or an adherence that we sometimes will call an adhesion, but true fibrous bands that can go in and triggered lots of times by an inflammatory response or by a surgery, and they can strangulate or cut off, squeeze off part of the intestinal tract. And you can get some tumor growth as well. Gastroparesis is something that is not readily recognized, and it can create a lot of discomfort. A lot of times people feel like they have to burp a lot. They'll swallow air and then they'll burp and then they'll feel better for a little while. So, but it's a delayed emptying, and it's a slowing down of the stomach through the food. or stomach through the food through the stomach. And it just allows for gas to build up, and it's uncomfortable. So cystic fibrosis is a mucus condition. It can be treated better now than in the past. So sometimes especially in the lungs, they would use percussion to try to break up the mucus and have the person eliminate that. They actually use shaking vests these days. Pancreatitis can be, it's an inflammation of the pancreas. That can be not a nice thing. It's very intense pain. And it is a medical emergency. So you also have to watch for pancreatic cancer, which is sneaky. It doesn't necessarily show a lot of symptoms until it's at advanced stages. Same with colon cancer and stomach cancer. So they're slow growers, kind of sneaking around in there, and then it doesn't really show until maybe there's an obstruction or there is some sort of bleeding that shows up. Here are your indications and contraindications, and here's a little segment on massage to support movement of fecal material in the large intestine. And read through this. Again, remember that if you don't recall what a term is, then you need to slow down and figure that out. And then we get into the urinary system, and we cannot affect the urinary system directly. We possibly can move fluids around that would be filtered through the urinary system. An unrecognized function of the urinary system is electrolyte balance and blood pressure balance. So here are the structures, here are the functions, and here are the organs. Kidneys are real important. They, along with the liver, they're our main detoxification organs. Kidneys, in addition, through their endocrine function as well as their blood pressure function, are huge in regulating homeostasis. Ureters, bladder, urethra. Now, urinary function is the ability to filter fluid and then this is where all these fluids are at, and eliminate a concentration of the waste product in urine. So indirectly then, it's going to be involved with a lot of fluid balance in the body. And water, we're inside our skin superficial fascia fishbowl here. We're a water medium. And so that fluid is involved in multiple aspects of our physiological functions. We also have hydrostatic forces and osmotic pressure. So this is the influence of water pushing out against structures. And then here's our section on the electrolytes and the acid alkaline balance in the body. We often think about pH and the pH acid base balance, and the normal pH of the blood is just a little on the acidic side, just a little bit. And then here are your conditions, your pathological conditions of the urinary system. Here's a picture of pitting edema. Now, one of the more serious things that we might recognize and then encourage the person to see their physician is urinary tract infection. What we might notice is that the client has to get up and use the restroom during the massage, especially if that's not their normal behavior. Be careful that pain in the lower abdomen and back can be signs of a kidney infection and not some sort of musculoskeletal issue. And of course, if somebody has fever and chills, nausea and vomiting, that would be a contraindication for massage. So bladder infections are also common, and they can be stinging and create an urge incontinence. And then incontinence is much more common than, we're more direct about it now in dealing with incontinence. And there are pads and underwear and that sort of thing that can help with leakage. We need to be sensitive to that. We also need to realize that some people may need to use the restroom more frequently. So this is common, and you want to be compassionate about what it is like to deal with bladder leakage, and or less common, but does still exist, fecal leakage. Kidney stones are really painful. Nobody is going to want a massage if they are dealing with a kidney stone. Obstruction, enlarged prostate is common. This will be discussed in the reproductive chapter. Inflammatory processes inside the kidney, and then kidney failure. And the biggest causes for kidney failure is diabetes. So you want to be aware of that. Kidneys are one of the more commonly transplanted organs. And then here is our generalized indications and contraindications for therapeutic massage for the urinary system. And then finally, our last system is the reproductive system. And our main support within the reproductive system is support during pregnancy, prenatal and postnatal. So we're going to look briefly at the organs of the reproductive system, and then go into much more depth related to the pregnancy process. So here's your male reproductive system and the hormone control. The reproductive system is very integrated in with the endocrine system. And then here's a female reproductive system. And then the difference in birth control between male and female. And then the pregnancy. So sometimes the pre and postnatal massage is an area of specialization. So we want to make sure that what we're providing for our clients is a safe and stress-free pregnancy experience. There are no indications that massage at any stage of pregnancy is going to cause a miscarriage. That's a myth. So also massaging around the ankles and some of that's just not true. So if you're gonna work with somebody who's pregnant, then you need to understand more about pregnancy. So here's generally what happens in the first trimester, second trimester, and then get down here, the last trimester. And one of the things that we also do is watch for where the pregnancy is not a normal pregnancy, and any kind of discussion that the client might have with us, such as vaginal breathing or bleeding, or some sort of aggressive swelling. We want to make sure that we refer immediately on those. So this gives you all the stages and how to support that. And down we go. And then the birth process, pre-labor, early labor, active labor, transition, the delivery. You don't do a lot of episiotomies, but that still can occur, especially if there's some sort of a medical emergency. Occasionally this is done if the cord is wrapped around the baby's neck and it's interfering with breathing, or starting to pull away, or if the position of the head is not ideal and forward. So that would be an indication to widen. That's what an episiotomy is to cut and widen the birthing canal. C-sections, in that situation, we can, in the postnatal period, we can start to work with scar tissue pliability formation as part of the massage. An understanding of the placenta, and then lactation, an idea of lactation. Of course, if this is related to the autonomic nervous system and the endocrine system and stress response, and also how to adapt and accommodate someone who is breastfeeding. Now, the postpartum time, this is the return of the body to a pre-pregnancy state. We kind of don't do a really good job of supporting the person during this time. And in other societies, they've got somebody that comes in and for the first few weeks and takes care of the house and all of that. And we kind of don't do that in our society. And so the disrupted sleep pattern with a newborn, the endocrine shifts and changes, the nutritional changes, especially if breastfeeding is happening. There can be pelvic floor dysfunction. That can be some urinary incontinence that we talked about earlier. There can be some prolapse and some weakening of the membranes between the vaginal tract and the rectum. And so all of this can happen in the postpartum period, and lots of times isn't talked about. And there can be, especially related to those endocrine changes and the sleep disturbances, there can be postpartum depression. And you may, if you're working with a postpartum client, you want to watch for the postpartum depression. It can get serious quickly and move into postpartum psychosis. And you want to encourage help. And again, the referral would go to their general practitioner, or if they're still seeing their obstetrician, gynecologist, and encourage the client to be an advocate for themselves, because this can be, it's better understood now than it used to be, and there are treatments and helps. So there you go. You can read more about that. And then here are your recommendations for massage during pregnancy. So, pathological conditions of the reproductive system. You can have abnormal pregnancies. So there can be bleeding. Sometimes that's an indication of a miscarriage and sometimes not. There can be a loss of the pregnancy. And when it happens in the first trimester, most commonly there's something wrong with the fetus and fetal development. It also can be that the placenta doesn't attach quickly or well, and that's something that they can look at. It can be where the cervix doesn't stay closed, and they can put a little suture in there. But massage doesn't cause any of this. It just happens most commonly in the first trimester. Ectopic pregnancy happens in the fallopian tubes, and that can be a medical emergency. So it is very painful. There's some bleeding that can happen with it, and the person may not even know that they're pregnant. Preeclampsia, toxemia, pregnancy-induced hypertension. This is something that can become a medical emergency. We would want to look for increased swelling, changes in the blood pressure, and this is an immediate referral. You can also get cysts and lumps. We talked about breast cancer in chapter 11. Then we've got cervical cancer, which is, there are regular screening tests to look for that. We can have inflammation of the cervix. Endometriosis is a overgrowth of the lining of the uterus. It's quite problematic. You can have something called polycystic ovarian syndrome that can interface with all of this as well. The person can have a lot of premenstrual pain with can't say the word, endometriosis. Ta-da. Infertility, that is a difficult situation for somebody who is wanting to conceive, and there really isn't anything massage can do to support infertility, or to make a person more fertile, other than stress can exacerbate these conditions. And if somebody is doing stress management activities such as massage, that creates more likelihood of fertility. But there's no such thing as a massage to correct infertility. You can also have uterine disorders, growth. Some of these can be endocrine producing. Fibroids are more of a connective tissue growth, but they can become pressure, they can produce pressure, and they can increase menstrual bleeding. Vaginitis is usually a yeast or a bacteria that is causing an infection. And then here's your prostate disorders that can lead to obstruction of the your urethra, and that often is a place where cancer develops as well. Then we have our sexually transmitted infections, and we need to have awareness on this. Syphilis does have a skin canker, a sore. It can show up, and it is treated. It is treatable. Herpes simplex, and type 2. We wouldn't see type 2 because it's on the genital area. However, it is a contagious condition, and it is sometimes triggered by stress. And then here is our general indications and contraindications. And again, this is the same activity that was talked about in chapter 11. Choose a pathology or a condition. If maybe you're really interested in working with oncology care, or maybe you're interested in working with pre and postnatal. But what you're going to do with this is, using this template, you're going to develop a justifiable adaptation and care plan related to that situation. This is very much an integration process. So here's your section summary and the chapter summary. And our last end of chapter scenario and multiple choice questions for discussion and review. All right, here's our orange online course. And here are our last two chapters: integumentary, cardiovascular, lymphatic, and immune. And then chapter 12. And so you're going to want to work through these, and some suggestions is for a study strategy for the NBLEX exam is to go back through and work through these modules. That's a nice way to review this content. Redo those 25 question module exams, and give yourself a chance to have repetition using the online course in conjunction with the textbook. So let's stop the share. And in conclusion, there's a glossary. Read your glossary. It helps you recall, look at all of the videos, the YouTube videos that I have posted. Look for overlapping content in your Fundamentals of Therapeutic Massage book, and pay attention to the pathologies and the language and terminology. That's what's going to help you with how you adapt and communicate with your client and other healthcare providers, as well as how you use critical thinking and problem solving as you challenge the NBLEX exam. And you only have to take that exam once. And if you don't pass it the first time, oh, well, there's a lot of stuff to know. And like I had said earlier, it's a whole ocean full of information to have one bucket full of questions, 100 questions on that licensing exam. Um, so, you know, you've got to be prepared to do the educated guess thing with that. And it's no fun to have to go take it again, but it's not life-threatening either. Uh, and so the accumulated knowledge through this textbook has got ongoing influence in your professional development. The sciences are important, and understanding how massage is beneficial um, comes back to the sciences. So, what I hope you do is once you've passed the MBLEX and got your license and you're all set to go, uh, that you revisit this science book. You'd be surprised how much you missed the first time through and how it can support your ongoing professional development and become a resource for you as well. So this is the end of this part of your professional journey. And um, you're at this point preparing to graduate, and I am proud of you.